Hello, my name is Vera Teveldi, and I'm a behavioral economist here in the UQ School of Economics. Today I want to talk about the importance of social norms during the COVID-19 pandemic. Humans are by far the most social species. Other species like these bonobos live in groups and achieve goals together, but we go far beyond that. Not only do we protect our close family members, we also altruistically care about even complete and distant strangers. We've evolved empathy and impulses to cooperate and punish those who don't follow social norms. We're the only species that could conceivably counterattack a pandemic, not only because we have the intelligence to understand the problem, but because we have the social ability to coordinate a global response. To see just how strong our impulses are to follow the crowd, we can look back on the seminal experiments of Solomon Asch. Which line on the right do you think matches the line on the left? Asch asked this question to groups of 12 people, 11 of whom were secret Confederates hired for the experiment. It's not a difficult question, and most of the time everyone agreed quickly on the answer. But occasionally, the first 11 people would all agree on an incorrect answer. The last person, the subject of the experiment, was always confused and usually conflicted about what to do when this happened. But despite the clear disagreement between reality and consensus, 76% of people went along with the false group consensus at least once. This shows just how powerful the urge to conform can be, but it isn't absolute. As soon as one other person in the room gave the correct answer, the last person almost always did as well. What this means is that small groups can be very good at keeping everyone in line, even if there are occasional dissident members. But on the scale of a country, there will always be other dissidents to team up with, so pure conformity pressure won't be enough to convince an entire population to adopt new norms and practices like elbow bumping and social distancing. During the pandemic, though, the goal isn't to force people to do something that they disagree with. A vast majority are in favor of behaviors like social distancing and mask wearing. We selfishly want to protect our own health by hand washing and so forth, but we also intrinsically care about protecting others, for example, by mask wearing. But humans are not usually blindly altruistic. We're conditional cooperators. That means that we want to do the right thing, but only if enough other people are also pulling their weight. In a situation like the one pictured, we might litter since we can see that many other people are also littering. Robert Cialdini has shown the power of the combination of intrinsic motivation with conformity in many experiments. In the study shown on the left, he put flyers on cars in a parking lot and observed how many people littered their flyers. The more litter was already laying around, presumably from other litterers, the more likely it was that they would also violate the social norm. What this means for us is that the more people are adopting new health and safety norms, the better, because that positive example will make other people willing to do their part as well. It also means that it can be very damaging to pay too much attention to the dissenters. The media coverage of the anti-lockdown protests in Melbourne could have created a dangerous impression that a lot of people were against the lockdown, even though the protest was very small and represented a tiny minority of the population. So why do we see so much variation in behavior in different states and countries during this pandemic? Of course, the situation is very different in different places. Some regions enforce social distancing legally and others don't. Some regions have serious outbreaks and others don't. And some populations are simply less able to afford to do things like work from home. But even ignoring these differences, we see striking variation in behavior. These two graphs compare Victoria in Australia with Arizona in the United States. Both states have roughly 7 million people, and both were severely hit by COVID during July and August. The graphs show the change in usage in different categories from March until September. In the first wave, which was not too serious in either place, we can see a noticeable drop in usage of parks, retail, and pharmacy during that time in both places. But Victorians immediately reacted to the more serious second wave and dropped their usage even more than before. The second wave in Arizona, which was actually much worse than in Victoria, is barely detectable in the data. Understanding the difference will be a topic of research for years to come, but we can already make some educated guesses based on what we know about social norms. First of all, disagreement about norms, like what we're seeing in the United States, can undermine cooperation. We're less likely to conditionally cooperate if we think a lot of the population doesn't care to do their part, and we don't feel so much pressure to conform when the norm isn't obvious or unanimous. My own research is investigating this phenomenon and will hopefully be able to make sense of why some regions are harder to mobilize to action than others. People also might simply be unaware of changing norms. In some East Asian countries, there was a pre-existing norm of wearing a mask while sick, which you may have noticed if you've ever coughed on a bus in Taiwan and attracted some glares. These countries were able to quickly adopt universal mask wearing. In other countries like Australia, much more education about the benefits of masks has to happen before people will feel an intrinsic motivation to wear them. We may also be less subject to conformity pressures if we don't know how many people favor certain behaviors or how many people are already doing them. For example, if we're staying home and we see a news story about a party, we might think that we're the only Trump staying home. Or we may have missed an important news story about aerosol transmission in enclosed spaces, so that we remain unaware of a general shift in attitudes favoring outdoor activities and strict social distancing. When norms are changing rapidly, it's natural that recognition and internalization of a norm will take time to propagate. Lastly, research shows that general trust in society promotes cooperation. This figure shows the results from an experiment done in 16 cities around the world, where groups had the opportunity to cooperate together for 10 rounds in a row. In high-trust countries, people expect that norms will be enforced and trust that others will do their part, and so cooperation is sustained at very high levels. In lower-trust societies, cooperation tends to fall apart. Australia has one of the highest levels of trust in society and in government, so I'll finish on the optimistic thought that perhaps our national pride in mateship is part of why we've done so well overall to keep the pandemic at bay. Thank you for listening.